Now that you are in your respective rooms, I will explain how we will share information and how you can ask your questions. The presenters will use the chat feature to share links and additional information with you. You will be unable to write in the chat. You can only use the question and answer box to ask questions. We have activated an upvote feature. You can upvote on a question that you wish to be answered, and it will vote up the list. At the end of the presentation, we will verbally respond to your questions, as many as possible. We encourage that you listen through the end before writing down your questions, as in many cases, the clarifications are provided in the content. Again, thank you for joining us this evening of September 24th. My name is Carla Fernandez-Gois, and I will facilitate this webinar. Thousands of providers have participated in our statewide webinars over the past few years, and we look forward to sharing even more information with all of you tonight and in future webinars. We recognize that you have many choices and that tonight you chose to be here with us. We appreciate that. We have compiled some information that will interest you and have invited special guest speakers who will share valuable information and resource. The presentation we have put together includes program updates and contents to address topics based on questions we have repeatedly received and based on your survey results. We have incredible guest speakers joining us. The first is Monet Pahan Lee, Health Education Consultant, Center for Health Community Nutrition and Physical Activity Branch, followed by Dr. Lily Horn, Clinical Policy Section Chief from the Immunization Branch at California Department of Public Health, who will be sharing with us information regarding immunizations and giving resource for anyone working with children focusing on back to school. She will provide an overview of the immunization requirement and help you understand what it is needed and when. We also have our child care advocate and technical support program, Kelly Ferrara, who will be sharing information regarding reporting requirements for child care centers and family child care homes. It will help you understand when to report unusual incidents and other additional reporting requirements based on our Title 22 and Health and Safety Code laws and regulations. Tonight, you will leave with great knowledge on these topics. Now, let's look at our updates. PIN 24-08-CCP, issued on May 30th, 2024, which provides us with information regarding legislation changes affecting child care facilities. The Senate Bill Summary SB2, effective January 1st, 2024, speaks to the parental notification and firearm storage requirements for anyone with a carry concealed weapon who also operates child care facility, either licensed or license exempt, in their home. Title 22 Regulations Section 102-417 for family child care homes and 101-238 for child care centers establish the standard for firearm safety in licensed child care settings and are not superseded by passage of SB2. Firearms shall not be allowed on or stored on the premise of a child care center. Family child care homes shall have firearms stored and locked such that they are inaccessible to children. In lieu of locked storage of firearms, the licensee may use trigger locks or remove the firing pin. Firing pins and ammunition shall be stored and locked separately from firearms. These requirements apply to all firearms, regardless of whether someone in the home holds a license. What does SB2 mean? It is consistent with the prohibition on the storage or possession of firearms in a licensed child care center and doesn't prevent the operator of a child care facility in a family home from owning or possessing a firearm as long as licensee follows requirements already stated under Title 22 Regulations 102-417 and SB2, and the child care provider notifies clients that there is a firearm in the home. Local law enforcement agents that issue carry concealed weapons license are responsible for determining if an individual meets the conditions of carry concealed weapon licensure and might be subject by law enforcement agents to a new carry concealed weapon license requirements if they also provide child care in their home, including both licensed care and licensed exempt care. Family child care home licensees who hold or live with someone who holds a carry concealed weapon license can be directed to the law enforcement agents. For further information on any impacts to the conditions of carry concealed weapon licensure as a result of SB2. Now let's look at SB 114. As effective July 10th, 2023, SB 114 amended Education Code, also known as EDC, Section 46-120, regarding the Expanded Learning Opportunities Program, also known as ELOP, for all children in classroom-based instructional programs. An ELOP may operate before school, after school, summer, and during intersections at a school site or at a location other than a local educational agent's school campus. ELOPs serving transitional kindergarten or kindergarten children shall maintain a child-teacher ratio of no more than 10:1. ELOP may operate without obtaining a child care facility license pursuant to Health and Safety Code Section 1596, 792H, and EDC 46-120 B10B. However, this bill doesn't exempt an ELOP from complying with child care facility license requirements when serving children who do not participate in the after-school education and safety program. What does this mean for SB 114? This bill is for child care facilities who operate an ELOP. The California Department of Social Service, also known as CDSS, will consult with the California Department of Education, also known as CDE, so that the CDE can establish a process and timeline for local educational agents that contract with third-party providers to operate ELOPs. at a location other than a school campus and California State preschool program providers to annually submit program access information to CDE, which shall distribute a compiled list to the CDSS for purpose of community care licensing division data collection and submission to the applicable resource and referral agents. Now let's look at Summary SB 722. It speaks to the child care facilities, plans of operation, and incidental medical service plan. It requires the department to create a template form for plans of operation and incidental medical service plans. This bill also requires the CDSS to revise its regulations and eliminate any requirement that an incidental medical service plan or amended plan of operation be approved before a child with exceptional needs is allowed to attend a child care facility. What does SB 722 mean? A licensee who submits to the CDSS a completed incidental medical service plan using the template form may enroll a child prior to the department approval of the plan. The department will develop a template form for plans of operation and incidental medical service plans. It eliminates any requirement that an incidental medical service plan or amended plan of operation be approved before a child with exceptional needs can attend child care. Now let's talk about water safety. In California, drowning is a leading cause of injury-related deaths of children under the age of 5 and children with developmental delays. Drowning can happen suddenly and silently, even in areas with as little as 2 inches of water. Never leave a pool area unattended when children are present. Caregivers must always be present and constantly supervising children when in bodies of water, no matter the circumstance. Water safety also includes infants and small children when in a bathtub. Remember that children with special needs are at a greater risk. As a best practice, licensees and families should encourage the use of bright or neon colored swimming wear to ensure that it will be easier to see. Water activity ratios, as well as taking all precautions needed, are important year-round. Water safety is not only to be observed when around swimming pools. Water safety requirements or measures is in place for all bodies of water, including water play tables and a forgot standing water bucket. Ensure that you check all areas around your facility for bodies of water, even if you don't have a pool. Parents trust you with the responsibility of their children. This pin goes through all the Title 22 regulations, statutes, and health and safety code around water safety requirements. Now let's look at our next pin update, which is pin 2410-CCP. This pin provides valuable guidance for preventing child abuse, the importance of connecting families to service, recognizing signs of abuse, reporting suspected child abuse, and a lot of resource. Interested professionals and parents have invested in supporting a shift from mandated reporting to community supporting. Mandated reporting laws are in place for professionals and community members who work with children and families, such as teachers, child care providers, social workers, doctors, police officers, and other child-serving individuals, requiring them to make reports of suspected child abuse or neglect to appropriate government authorities. The majority of these referrals to CPS hotlines are primarily reports on suspicion of neglect. In many situations, neglect cases are connected to poverty, including a lack of housing, basic utilities, food, and medical and legal support. Some neglect situations involve children at risk due to a lack of service for the parent, guardians, such as treatment for behavioral health condition, domestic violence, or substance abuse. Here's where the shift comes. All these problems may be addressed more effectively outside of the child welfare system through access to alternative community resource for support. Early data show that the new law is having its intended effect of reducing the number of children removed from their homes and placed into foster care. Next slide. We would also like to share with you this quarter awareness and resource. We will be talking about what we have in this quarter that we want to bring to your attention. October is Fire Prevention Month, and as California gets hotter and drier, the threat of fire increases. Forest health and fire prevention work in and around communities reduce the fuels that feed catastrophic fire. These projects, combined with the annual defensible space inspections and homeowner education, are strategies to help everyone be ready for wildfire. Fall is an active season for wildfires in California, so be prepared to respond in the event of an emergency. Ensuring that emergency disaster plans for child care centers and emergency disaster plans for family child care homes are updated and complete will help providers and facility staff if relocation is needed due to a fire. Both family child care homes and child care centers must and document fire drills every 6 months and have a functioning smoke detector. Creating a safe plan, practicing the plan, and having the equipment and resource to notify authorities if there is a fire is key to maintaining compliance and keeping everyone safe. Make sure parents are informed and aware of fire safety plans. The Community Care Licensing Division, also known as CCLD, has established a dedicated disaster response homepage on its website to provide resource to everyone to be ready for wildfire. Fall is here. Please make sure that you have reviewed your plan, that you make sure that you have equipment and resource to notify authorities. The Community Care Licensing Division has provided resource through CCLD licensing facilities regarding disaster-related service. Please check the web page and ensure that you are updated and that the families that you serve also know what's the plan. Lights, camera, action. Red Ribbon Week started in 1988 and inspires our kids to be drug-free, happy, and brave. It takes place every year from October 23rd through October 31st. It is our opportunity as parents, providers, educators, and communities to reinforce the drug-free message. This is time to highlight the importance of living a drug-free life. This resource can help make your Red Ribbon Week the most impactful ever. These resources have a lot of activities that you can share and you can use to serve your children. Since these webinars are offered quarterly, we also want to acknowledge observance and campaigns for the upcoming months. The Hispanic Heritage Month, it started in 1968 by Congress for a week. The Hispanic Heritage Month is celebrated between September 15 to October 15 annually. It celebrates U.S. Latinos, their culture, and their history. November is the Native American Heritage Month. This month was chosen because this is generally the end of the traditional harvest season and a celebration for Native Americans. Red is the color chosen by Native Americans to celebrate because red is a color that transcends the physical world and calls to the ancestors in the spirit world. This is the time to recognize the history, culture, and contributions of the Native American people. Since 1987, Library Card Sign-Up Month is held in September to mark the beginning of the school year. It is a national campaign to emphasize the importance of literacy to a child's education and to combat illiteracy. Reading is a crucial role in the education and development of children. We know these are few of many other important awareness campaigns that are equally worth of noting, including the one on our next slide, when we take the opportunity to highlight October Depression Month awareness. The purpose of Depression Mental Health Awareness Month is to increase understanding, decrease stereotypes, and help understand that depression and other mental health issues impact people. Depression is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for long periods of time. It is not the same as mood change. The individual will feel sad and loss of interest consistently. It can affect all ages, including children. If you or someone that you know is experiencing depression, seek mental health service. Our next slide is to celebrate this year the important mile for Child Care Advocate Program. It is our 40th year anniversary. In 1984, SB 1754, sponsored by Senator Art Torres, was passed. Passage of this bill resulted in what we know as the California Child Care Facilities Act. This bill resulted in a lot of change. To name a few of the many changes, it required ongoing training of licensing staff and developed the Child Care Ombudsman Program, what we know today as the Child Care Advocate Program. And in addition to establishing separated child care facility standards, it also separated within CCLD the residential programs and the child care program. Thus, the child care program that we know and love today was born. Now, I would like to invite our first presenter. I have the honor to welcome Monique Parhan Lee, Health Education Consultant, Center for Health Communities Nutrition and Physical Activity Branch. She will be sharing with us the results of her survey. Monet, please.
Thank you so much, Carla, and good evening, everyone. Yes? Okay, thank you so much, Carla, and good evening, everyone. As was mentioned, I'm Monet Parham Lee, a senior health education consultant with the California Department of Public Health. As many of you may recall, the nutrition and physical activity trainings, next slide, please. As many of you may recall, the Nutrition and Physical Activity Training's Child Care Professional Survey was shared during the June 25th Child Care webinar, with July 19th being the desired deadline for responses. Thank you to over 160 providers who responded. Now that the responses have been reviewed, we will get started planning professional development opportunities to address the topics providers indicated an interest in. Some of the training topics will be addressed on future childcare webinars like today's event, and others will be addressed during standalone webinars or through recorded modules, depending on the topic. Next slide, please. Here's a snapshot of what we learned from the survey responses. Over 70% of respondents were from family childcare homes. And thank you again for your responses, with roughly 26% being from centers. The main nutrition topics of interest were in healthy mealtime practices and the CACFP meal patterns. The main physical activity topic of interest was healthy physical activity promotion, along with tools and ideas for providers to use. There was equal interest in screen time, age guidelines, and educational or physical activity uses for screens, and interest in outdoor learning centered around physical activity, gardening, and academic subjects, such as math, science, and literacy. Interestingly, respondents were nearly 50-50 about their interest in live webinars versus recorded modules, with 1 hour being the most popular length for the webinars or the modules. 73% of respondents want English events, with 25% wanting to have accessibility in Spanish, and no other languages were indicated in the survey responses. And finally, all professional development opportunities, among all professional development opportunities, interest was greatest in virtual trainings and printable materials over website content, social media content, or peer sharing opportunities. I want to thank you again for participating in the survey. We look forward to engaging in future trainings, with the first mini training taking place in the December childcare webinar here at the same place, where we will discuss screen time age guidelines and educational or physical activity uses for screens. Thank you again for your time. Good evening.
Thank you, Monique. Thank you very much for being here. We really appreciate your presence and appreciate that you are able to join us tonight. Now we're gonna have our next presenter, and I would have the honor to welcome Dr. Lily Horn, Clinical Policy Section Chief from the Immunization Branch, Department of Public Health. Dr. Horn, thank you for being here. You can unmute yourself. Thank you.
Thank you, and good evening, everyone. Thank you for having me here today to share immunization updates. I'll go over respiratory season immunizations and required immunizations for childcare attendants, as well as some immunization reporting requirements. Next slide, please. So let us all work together to get our children's routine vaccinations back on schedule. During the COVID-19 pandemic, we saw a concerning drop in routine immunizations for young children. And immunizations are really important to protect children against serious diseases like measles. In fact, we've seen measles cases and outbreaks have increased worldwide, with young children most vulnerable to severe illness. And many of those young children who became sick with measles have been unvaccinated based on some studies and some US statistics. Immunization recommendations are that all children should get 2 doses of measles vaccine. Dose number 1 should be between 12 to 15 months old, and dose number 2 should be between 4 to 6 years old. Also, children need measles vaccination before traveling abroad to any country. If a child is between 6 to 11 months old, then they should get an early dose of the measles vaccine before travel. And afterwards, they are still recommended to get the 2 routine doses at 12 to 15 months and at 4 to 6 years old. At the bottom of this slide are CDC and CDPH web pages with more information on routine immunizations and also some specific measles information. Next slide, please. Immunizations can also help protect us during this upcoming fall and winter respiratory virus season. Among children, those under 5 years of age have the highest rates of hospitalization for influenza, also referred to as flu, COVID-19, and respiratory syncytial virus, which is abbreviated as RSV. On this slide, on the right side and at the bottom, CDC has information on COVID-19, flu, and RSV hospitalizations in children. In past years, COVID-19 caused 22,000 children to be hospitalized. Flu caused 20,000 hospitalizations per year, and RSV can cause anywhere between 58 to 80,000 hospitalizations in children per year. We know that vaccines can protect children and their families against all of these severe respiratory infections. And while flu, COVID-19, and RSV vaccines are not required for preschool or childcare attendants, they are very important for children's health. Next slide, please. So respiratory syncytial virus, or RSV, typically causes cold-like symptoms, but can be severe in infants and older adults. Nearly all children are infected with RSV at least once by age 2, and the youngest children are at the highest risk of severe RSV disease. Immunizations are now available for certain groups to protect against severe RSV. From October to March, nirsevimab is recommended for babies in 2 groups. For babies who are under 8 months old, if their mother was not vaccinated during pregnancy, then the baby should get nirsevimab. And for older children, 8 to 19 months old, who are at increased risk for severe RSV disease, they should also get nirsevimab. For pregnant people, they should receive the RSV vaccine to protect their babies. The only RSV vaccine approved for pregnant people is named Abrysvo, and timing should be between 32 through 36 weeks of pregnancy from September to January. And when a pregnant person is vaccinated, they make antibodies to protect themselves and also pass these protective antibodies to their baby. For older adults, all adults 75 years and older and adults 60 to 74 years old at increased risk should receive 1 dose of RSV vaccine. 1 dose of RSV vaccine is expected to protect for at least 2 years. So people who were vaccinated last year do not need another dose this year. And the links at the bottom of this slide give more information on RSV. Next slide, please. Vaccinating against COVID-19 and influenza are also important ways to keep our children healthy. The virus that causes COVID-19, which is SARS-CoV-2, is always changing. And receiving an updated 2024-2025 COVID-19 vaccine this fall provides better protection against the current strains that are circulating and against severe illness. In fact, everyone 6 months and older should get an updated COVID-19 and flu vaccine this fall. Both are now available in most doctors' offices and pharmacies for all ages. And for young children who are 6 months to 4 years old, if they are getting COVID-19 vaccines for the first time, they will need at least 2 or 3 vaccine doses to be fully protected. And for young children who are 6 months to 8 years old, if they are receiving a flu shot for the first time, they will need 2 flu vaccine doses to be fully protected. Everyone else needs 1 dose of this year's flu vaccine and 1 dose of this year's COVID-19 vaccine. And the links at the bottom here show the respiratory virus hospitalization page by CDC, and also a link to the flyer on the right about everyone needing flu and COVID-19 vaccines. Next slide, please. So let's switch to talking about required immunizations for attendance. There are specific pre-kindergarten immunization requirements in California, and all California pre-K sites are required to check immunizations for all new admissions at each age checkpoint. The table on the right shows that the required immunizations include vaccines to protect against polio, diphtheria, tetanus, pertussis, which causes whooping cough, as well as hepatitis B, Haemophilus influenza B, measles, mumps, rubella, and varicella, which is also known as chickenpox. We have a lot of immunization resources for childcare staff, which can be found at the Shots for School website. And some key resources include the immunization guide for pre-K entry, implementation tools for how to check immunizations, as well as interactive training modules for understanding requirements and processing records. We also have trainings and a guide for staff on how to process medical exemptions to immunizations. And there are resources in multiple languages, including Spanish and Chinese. Next slide, please. For some facilities, immunization reporting to CDPH is required annually. Child care center preschools who have children ages 2 to 5 years old must annually report the immunization status of their enrollees to CDPH every year. Reporting is now open, and this year's deadline is December 13th, Friday. So Friday the 13th, easy to remember. We encourage you to submit your reports early so you have enough time to ask any questions if needed. And please check the reporting website for deadlines and more information. The main website is called Care Hub, and I will put that link in the chat since this slide, I think the link was not correct initially. If you look on the right side of the slide, it shows you that after you sign in to Care Hub, then you can And training materials for reporting are located at Shots for Schools reporting pre-kindergarten link on this slide. If you have reporting questions, please look at the information on the link to Reporting Frequently Asked Questions page. And you can also email schoolassessments@cdph.ca.gov. And for general immunization questions that are not about reporting, you can always email shotsforschool@cdph.ca.gov. Next slide, please. Please also reach out to your local health department or LHD with any immunization-related questions. The link on this slide has contact information for your local health services and the offices in California. And your LHDs are a huge resource. They can help with immunizations, information about local services for immunization and primary care, as well as information about vaccine preventable diseases. Next slide, please. And immunization resources are also available for parents and guardians of children on the shotsforschool.org website. These materials go over the required immunizations for pre-K or childcare, as well as required immunizations for school entry. And these are all resources for parents and guardians that have been translated into multiple languages. And the links on this slide should go directly to those translated flyers. Other resources also include an immunizations brochure for parents, answers to some of their frequently asked questions for parents, and an immunization building block schedule with all the childhood immunizations on one page. This is my last slide, and I want to thank you for having me today and for your partnership in getting our children immunizations to stay healthy. And I'll be happy to help answer questions at the end. Thank you.
Thank you, Dr. Lily. It's always a pleasure to have you with us. Thank you. We all appreciate. Now, I would like to welcome our team member, Kelly Ferrara, from the Technical Support Program to share information regarding reporting requirements. Thank you, Kelly.
Thank you, Carla. Hello, everyone. I'm here tonight to review unusual incident reporting. Anytime there is an incident that occurs at the facility that is unusual or different from a typical day, it must be reported to the department. On the next few slides, we will discuss the type of incidents that must be reported. When the incident occurs, the provider must contact the local regional office within 24 hours. You may call the officer of the day or call or email your licensing program analyst. You can always leave a voicemail for them. You may not have all the information in the first 24 hours, and that is okay. You can give the information you have currently. Once you have all the information, you must submit the unusual incident report, LIC 624 if you are a center, or LIC 624B if you are a home provider. Please do not rush to send in the LIC document. The reason the department gives you 7 days to submit the paperwork is to ensure that you have all the required information regarding the incident before you submit the form. It should never say unknown on any part of the document. If you need additional space to report the details, you can use a separate sheet of paper attached to the LIC 624 or 624B. A common question that is asked is if providers need to call and submit the document. The answer is that if you have all the information ready to submit the report, you only need to send in the paperwork within 24 hours. However, best practice is to contact your LPA to make them aware of the situation and let them know they will be receiving the document. Paperwork should be mailed into the regional office, faxed, or emailed depending on the preference of your LPA and RO. Once again, it is imperative to report unusual incidents to the department. If the incident is not reported by the facility and a complaint comes in regarding the situation, the provider could potentially receive a citation for the incident and a citation for not reporting it. Next slide, please. Take a look at the list of reportable incidents on your screen. Please recognize that most of these incidents include immediate action, such as calling 911, the fire department, or poison control. Parents should also be called if there is a serious injury or incident that directly involves their child. After the situation is no longer an emergency, the next call is to your RO or LPA. Here are some examples of these incidents. Death of any child. Child left unattended. At a daycare center, if a child or children have been left unattended without the supervision of staff, inside the classroom, bathroom, outside, etc., for any length of time, it must be reported. Injury that required medical attention. A child at your facility who receives an injury that requires medical attention, either from the doctor, emergency room, urgent care, or dentist. Even if the injury appears to be minor, and you as the provider do not think it requires medical attention, it still must be reported if the parent decides to seek medical care. Here is an example situation. A child falls on the outdoor, complains of ankle pain, and the parent takes the child to urgent care as a precaution. In the first 24 hours, you must inform the RO that a child in care fell and hurt their ankle. Then the provider must follow up with the parents afterwards to learn the outcome of the medical visit. Was it a fracture? How long will the child not be in care? What are the statements from staff, etc.? Once you have that information, then you can submit the paperwork. Unusual incident or child absence that threatens the physical or emotional health and safety of any child. For example, the air conditioning breaking down on an extremely hot day, or a flood in the building could threaten the physical health and safety of a child. A personal rights violation in a center or home setting is also a reportable incident because it threatens the child's emotional health and safety. Suspected abuse of any kind. If you suspect a child is a victim of abuse, you must report it to CPS and licensing. Fill out a suspected child abuse report or SCAR, and that can be included when you submit the LIC 624 or 624B. Epidemic outbreaks. Some examples of an epidemic outbreak include flu, hand, foot, mouth, lice, and COVID. Poisonings, catastrophes, fires, or explosions. Next slide, please. Additional reporting requirements. For a center, if a new director has been hired for the facility, you must notify your RO and LPA and send in a new director packet within 10 days of the change. Best practice is to send in the paperwork before the original director leaves to ensure the new director is qualified. Structural changes to the facility. For example, adding a playground or play structure, altering the classrooms in any way physically, or adding a shelving unit that will cut down on your physical space inside. Organizational or operational changes. Some examples include if anyone on the board is leaving and someone else is taking over, if a partnership is separating and the individual will be operating the facility alone, or there was a change to an LLC. Also, if you change your operating hours, you must notify your LPA or RO. For a family child care home, if the licensee's own child turns 18, they now have 30 days to obtain a fingerprint clearance. If an adult moves into the home, the department must be notified to fingerprint cleared. Change to off-limit areas. If there is part of the home that has been previously noted as off-limits and you would like to use that space for children, your LPA must be notified so they can inspect the space for health and safety reasons and obtain a new facility sketch. If you would like to make a space off-limits, your LPA will also ask for a revised facility sketch to note the areas becoming off-limits. Next slide, please. Next, I am going to read some scenarios, and I would like everyone to decide whether or not it is a reportable incident. There will be a quiz that pops up on your screen to choose your answer. First scenario, please. Child falls off a play structure and injures their wrist. Parent takes the child to urgent care out of concern. Is this a reportable incident? Thank you for participating. Okay, let's go ahead and look at the answer. Yes, if a child receives an injury that goes above a Band-Aid and medical treatment was received, that must be reported to your RO. Next scenario, please. On the playground when the class transitions inside, should you notify your RO? Okay, thank you for participating in the quiz. Let's see the answer. Yes, in a center, if a child is left alone without the direct supervision of an adult for any length of time, that must be reported. In a family child care home, if a child wanders away from the facility for any length of time, that is also a reportable incident. Next scenario, please. Director observed staff drag a child away from a play area while the child was throwing a tantrum. Is this reportable? There's some mixed results on this one. Let's go ahead and see the answer. Yes, any violation of a child's personal rights must be reported. Last scenario, please. A fire started in a family child care home, causing the provider to evacuate the children. Should you report this? Quiz, please. Is there no quiz for this one?
Kelly, real quick, I apologize. For whatever reason, this one will not launch. So go ahead and continue.
Okay, let's see the answer then, Carla. Yes, any situation that threatens the physical safety of children in any way must be reported. Even if a fire occurred in a neighbor's home and the fire department came and also knocked on the provider's door to make sure everyone was okay, this would also be reported to the department. This concludes our refresh on unusual incident reporting. The beginning of a new school year is a great time to review and update your policies and practices, and a good time to audit staff and children's files to ensure they are complete and current. Make sure you have all items posted, including menus, parents' rights, any granted waivers for a center, and the emergency disaster plan. Make sure your fire drill log and facility roster are up to date as well. Thank you. Back to you, Carla.
Thank you, Kelly. Thank
You're
you so much for everything. Thank you. So we're gonna go just for a little more information so we can start your question and answers. I would like to thank our presenters for the wonderful information and resource. Now let's remember that staying connected is important for all of us. Let your child licensed program analyst or local regional office know when you have changed to your phone number, email, address, change of location, and any change to your operation or physical plan. A link to the local regional office contact information is in this slide, as well as on our DSS website. And remember that you can check through our slides. Copy of the slides is in our webpage. You can keep yourself current with licensing updates by registering to be on the distribution list. Once you are on this list, you can receive licensing updates through our provider information notice, also known as PINs, sent directly into your email. From CGSS homepage, you can click on the blue tab link. Receive important updates, or you can use your camera to scan the QR code on the right and register to be on the distribution list. We will wait a few seconds for those of you who wish to register now. All you have to do is provide your current email address and the types of programs you wish to receive updates. Thank you. We have one more webinar scheduled for this year. Our last statewide webinar for the year of 2024 is on December 10th. All of our webinars at this time are in the evening hours at 6 p.m. As always, we will post pins informing of webinar information, including registration link. After you register, you will receive a Zoom invite in your email inbox. We are aware that you all have a busy life and don't always have time to participate in all the webinars provided, or you might want to brush up on the information shared. Our webinars and other resources that can help you are posted on our webpage, www.cdss.ca.gov. There are a few of the webinar recordings on specific topics that are also available on the licensing website. Please take a few moments to complete the survey. We read your response and value your suggestions to improve the webinars. Based on your survey feedback and ideas, we have made multiple changes to our webinars throughout the year. At this time, you can take this survey by using your camera to scan the QR code that is showing on this slide, or use the link to this survey that is posted in the chat box. You can also take the survey when you receive it after this webinar via Zoom. We will wait a moment for those who wish to complete the survey. Thank you. At this time, I would like to invite Latoya Brown, the Bureau Chief of the Child Care Systems Coordination Bureau. Thank you, Latoya.
Carla, you are muted.
I'm guessing that Latoya might not be here right now. I would like to ask Shana, would you like to share a few
Can you
words?
hear me?
Yes. Oh, thank you, Latoya. Thank you.
Sorry, everyone. Hi, as Carla mentioned, my name is Latoya Brown, and I'm the Bureau Chief of the Child Care Systems and Coordination Bureau, which encompasses the Child Care Advocate and Technical Support Unit. Our team hosts these webinar opportunities quarterly to share timely and relevant information with the provider community. I am happy to be with you all this evening, and thank you all for joining us. Let me start by thanking the team for all their planning and coordination efforts to deliver this webinar. I would also like to extend a special thanks to our guest speakers for being here and for sharing valuable information and resources with you all. I would also like to thank the subject matter experts that are on the call to respond to the questions posed in the question and answer segment. Last but certainly not least, I would like to thank you all who are taking out time out of your busy schedule to participate. I want you to know that we sincerely appreciate you and your feedback, and we have received from you throughout the surveys provided thus far and that are conducted at the end of this webinar. We review every response. We are grateful for your encouragement and your kind words that you have shared, and we also appreciate all of the constructive criticism and suggestions for improvement that you have provided. Please know that the team does their very best to prepare and provide answers to questions